Um, so obviously things have changed in the last 48 hours in terms of confidence around a vaccine. I know it's still to get over its last hurdle, but the final question from my constituent was, how likely do you think it is that the vaccine will work, and how do you see the rollout of that? And do you think that if the vaccine, or if there was no vaccine, what would if if the vaccine didn't get approved for use, what would that mean in the long term? Would that still mean that we've got a long stint of lockdowns and challenges ahead?
So, firstly, I have a cautiously optimistic, shall we say, about the vaccines. Yeah, the Pfizer and BioNTech haven't revealed all the data from their study, so we don't quite know exactly just how effective it is. And when they say it's 90% effective, what exactly does effective mean? Is it effective in reducing the spread? Is it effective in stopping people getting disease, or is it effective in stopping people dying? What do you mean by effective? We also don't know how long the immunity will last. And we know that most of the people where the vaccines were tested on were people who were generally healthy. So how effective would it be in people who are not so healthy, who've got long-term conditions? We don't know yet. Lots of questions. That said, it's pretty amazing that there is a vaccine. And there are also others in the pipeline. So I think if you're a betting man, you'd be saying, well, surely one of them will work, fingers crossed. Yeah. But I think there's an important message out to everyone. Even if a vaccine became available and it's super effective, which is wonderful, it won't be available to everyone straight away. It will take time to roll out across the system. Yeah. I think the Secretary of State for Health was saying that we might get it even in December, but it will be in small numbers initially. It'll probably be for those at the very highest risk and healthcare workers initially. So it's not going to be rolled out across the country to everyone. And it may take many months to actually get it out to enough people. Yeah. That means in the meantime, we've got to stick with the measures that work, the hand washing, the face mask, the social distancing for the next few months at least, because the vaccine isn't going to stop spread. Not yet. It's too soon. It's not going to stop spread. So we've got to stick with the measures that we know work, unfortunately.
But hopefully there's a bit of light on the horizon and that we can see, hopefully, I'm confident that we should find our way through this, hopefully. Optimistic, I think, is definitely the word at the moment. Well, thank you so much for answering all my constituents' questions and questions about the COVID-19 pandemic. I think people will have found that really helpful and useful, and definitely, if I have any more questions, I will be picking up the phone and asking you if that's okay. But that's been really, really helpful and useful. So thank you so much.